it really depends on what parents feel is the primary cause for the sleep problem. Like, for instance, if they have a child who has epilepsy and the child is having seizures at night, then it stands to reason that they should, and they feel that the seizures are affecting the sleep, and obviously they would need to go to the neurologist to address the underlying issue. So in that context, it really does depend. I think many of the patients that I see, it's parents have gone through a process of exclusion, of rule outs. They've ruled out this, they've ruled out the seizures, they've ruled out the medical conditions, da 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 da, and now they've kind of covered the best they can everything that could be causing them issues with sleep, and that's how they end up with a sleep specialist. I think the take-home message is, if you've got a child with any kind of medical condition that could be associated with sleep issues, have that addressed by the relevant sleep specialist. And then kind of as a second tier, maybe seek the advice of a sleep of a sleep specialist. Now, sleep specialists come in different flavors. Most sleep specialists are still pulmonologists, which tend to focus on breathing problems and sleep. And in kids, breathing problems and sleep is a very, very small percentage. The majority of sleep issues in children are actually behavioral. So if you ruled out all that other stuff, then you may need to, see a specialist that actually has the ability to address behavior. Some parents will go to sleep trainers. In essence, there's nothing wrong with seeing a sleep trainer, but I've seen many parents that come and see me after they've spent many thousands of dollars with a sleep trainer who has really adopted a very narrow approach to maybe a situation that is much more broad and much more complex. And they don't necessarily have the skill sets to kind of look into other areas. And probably that's why they fail and they end up coming to see me. There may be many parents who go to sleep, people who profess to be sleep trainers who are able to help them, and it's done. It's a done deal, and it's good.